Hello, good morning. I'm Monosha Priyadashini of Vellore Institute of Technology, Vellore, Tamil Nadu, India. Is going to present a mini review on the enhancement of photodynamic therapy for the cancer treatment. So nowadays we are very seeing the world's second most leading death is due to the cancer. So what are the different type of therapies we have come across, and still it's under progress. Now the modalities is like they are marking different combinational therapies like chemotherapy with the photodynamic chemo, with the hypothermia therapy, or the immunology therapy, immunotherapy, gene therapy. More it is developing, and they are also using the nanotechnology to advance this treatment. So these are my glances I'm going to present. So we are going to see across like exactly a cancer, what it is. What's the difference between a normal cell and a cancer cell? The varieties of treatments undergone, those were analytically done, previously done, and now what are the more of the improvements are going on? The area of treatment, like will be considered the throwing focus on light and the photodynamic therapy, which itself includes a light. Now, a photodynamic therapy includes some type of drugs, which is called as a photosensitizer, which is the main involvement in this treatment, and also a particular wavelength of light, which can be changed according to the type of the photosensitizers. So, with a variety of lights that can be seen. So the nanoparticles also can be used. There are a variety of nanoparticles like gold, silver, upconversion nanoparticles. So the focus area is on here is conversion nanoparticles. The mechanism of PDT, like photodynamic therapy, so in a short way we call it as a PDT. The mechanism usually what happens exactly, how these photosensitizers and light together work as a team to kill the cancer cells. So usually the photodynamic therapy are used in great fields of diseases. We will be discussing in the further slides. Cancer. What cancer looks like? No. Exactly, yes. Tumors, first the cells unknowingly multiply themselves as a very bigger rate rigorously, which we called it as a bulge. The cells will bulge themselves, which is usually called as a tumor. So what exactly thing is like, it's like a tumor is called as a neoplasm. It's an abnormal tissue that grows with any no reason, but it grows from the pre-existing body cells, not having any functions, purposeful functions they don't have inside the body. But the main thing is to destroy the other living cells, growing very rigorously and multiplying within themselves. And it is characterized by the tendency of the independent and the restrained growth. So usually tumors are of two types. The benign tumors and the malignant tumors. Benign tumors can be treated, and once it is treated, it doesn't return back and it's not spreadable. But the malignant tumors are the spreadable ones. So once it is treated or it is touched, there are huge number of chances of spreading it all over the body, and we can't tell that either it is fully curable, because if it is also operated or given any type of treatment, there are 80 to 90% of chances they are of returning back. So these are malignant tumors are only called as a cancerous cells. So exactly what is a normal cell and a cancer cell looks like. So before that, so why a tumor grows? How a normal cell changes into a cancer cell? What's the reason is that? Maybe it might be due to the microstates of the inside the body, or the cancer cells which are surrounded by a variety of immune cells, fibroblasts, molecules, and blood cells, which are known as tumor microenvironment, which helps them to grow more developedly into the cancer cells. So now the cancer cells changes the microenvironment, which in turn can affect the cells to grow and spread around. So usually a normal cell. So here we can see how the normal cell dies and a cancer cell does not die easily. So what exactly is going on in this is that, see, the first graph which we are seeing is, so it is a normal cell. What it is a normal cell is like the normal tissue cells are there in very balance between the generation of new cells and doses of the cells through cell death. Apoptosis is a form of cell death, which is called as a suicide also, cell suicide, in which the genome of the cells and all its genetical information is broken down. This process is necessarily to refresh our bodies with new and healthy cells. But there are some proteins of whose function is to keep the cells alive, which work as a shield, like a protective shield, like a capsule having covered with capsule, covered with the body, sealed, the bulletproof, and prevent the cells from dying. As we can see in the second ZF, which acts the cancer cells. That's what the cancer cells are not dying easily. This is the huge difference between a normal cell and a cancer cell. So there are usually now the biggest question is treatment of these cancer cells, how the cancer rate can be reduced between the human. So treatment is widely accepted as a conventional way of method between the healthcare professionals and the conventional methods like surgery, radiotherapy, chemotherapy, and different types of medications. But in this modern era, the treatments are constantly changing with new technologies or breakthroughs, and the directions are so vast. But deciding which type of treatment or the molecule will be better or will be suiting at the right place is nowadays is very critical. So the modern therapies are gene therapies, hypothermia, photodynamic therapy, immunotherapy. Now the combinational therapies. You can combine the two therapies together or three therapies so that the rate of killing the cancer cells increases. So among all these treatments, here the focus of the author is on photodynamic therapy. Our focus is on photodynamic therapy, exactly what it is. So let's see what a photodynamic therapy is. So here I have shown a picture just to make it interesting. Photo does not mean that a camera or the shutter, which is usually we take images of the things. Now, photo means light. Yes, it's a light therapy. The light alone, it can't work here. So it needs something like dynamic. Usually we know dynamic means it's not stable. So, but here dynamic, like to understand what it is, dye means the drug dye. Our photosensitizer is, we can predict it for our understanding. So light and photosensitizer together will work to liberate or to generate oxygen, which can kill the cancer cells inside the body. This is what we call it as a photodynamic therapy. So it is a type of light treatment where the light and the photosensitizer, which is a chemical substance used in the conjunction with molecular oxygen to initiate the cell death. So light, photosensitizer, and tissue oxygenation, these are the main photodynamic efficacies for a particular patient. photosensitizers, now we can see that light and photosensitizers are playing the important role in the photodynamic therapy. So exactly what is a photosensitizer looks like? So the photosensitizers should be available from the precursors with high reproducibility and exist within the chemical composition. Means it should have the fluorescence property of emitting the light to a certain wavelength, and it should be pure, non-toxic. The important property is like in vitro and in vitro environment should be with highly hydrophilic nature. That is, the photosensitizer should show high disposable or soluble nature to be introduced in the blood flow system, or else it can cause blockage in the blood, which will be another issue to be treated. Because this if it is treated in a positive way, they can be fruitful. But if something goes in a bad way, then it is called as poisonous. So here the main objective of the photosensitizer is to have strong absorption of the light so that it can excite its cells from the ground state to excited state, and then it has so that only it can get the power of the fluorescence and phosphorescence property of emitting a certain wavelength of light which can convert into oxygen, which is responsible for killing the cancer cells. So he it should meet a high singlet oxygen quantum yield generation, means that the photosensitizer should have the power of producing high quantum yield oxygens. So the photosensitizers should produce cytotoxicity only in the presence of high radiation. Without light, it cannot be toxic. Those are non-toxic. So it should be handled very carefully. And once it is used, it should not be exposed to light. These are some of the instructions given usually. And in dark, it should be posed to very minimal uses, because high amount needs high amount of light, which in turn can kill the normal cells, which is not at all good. Finally, the photosensitizers should be easily extracted from the body. Yes, it can be easily removed from the body so that it should not, it will, usually it doesn't hamper the body, because when a person is treated, the photosensitizer is given. After 24 to 72 hours, it cannot stay in the normal cells. So there are different types of photosensitizers we can see. Like it has been divided into like, so the first what we have seen is porphyrimar sodium, like what it is called as photofluorine, belonging to the porphyrin class of families. It was first the photosensitizer approved by the FDA. So we have different generations like first, second, third, porphyrin, non-porphyrin, vector phase, chlorines, phthalocyanins, and ALA. Then hematoporphyrin, and some of the naturally occurring photosensitizers like hypersins. These are very helpful in treating the cancer cells. Usually the photosensitizers have a certain wavelength. It doesn't has a certain wavelength. It means that it has the fluorescent property. That means when light is irradiated on it, it has the power of emitting the light. Like photoluminescence property, it consists of photoluminescence property. Yes, so different photosensitizers have different types, power of emitting the light of a certain range like UV or visible range or IR range and IR range. So depending on that, depending on this property, the particular wavelength of light will be irradiated on that, so that only the photosensitizers would be reacted. It can excite it from the ground state to the higher excited energy level state, and so that we can get reactive singlet oxygen, which in turn will elicit cell death. So now having a good photosensitizer in one hand is a very good thing. But if light is not there, then it won't work there. So like we told, light is important to irradiate. Different varieties of lights are used here. So 50% of the work will be done by the photosensitizers and rest 50% of the work will be done by the light. Yes, and here the molecular tissue oxygenation will be playing a very great role here. Exactly, because if oxygen is only not created from the photosensitizer after the irradiation of the light, then who will be killing the cancer cells? Instead of this, it can be toxic, highly toxic, in turn killing the human itself. So we should be very, very, very careful in using all this. Yes, it has been proved very effective, very useful in the treatment, but certain things should be done in a limited amount. We should always try for minimal amount. So now, let's try for you. So desired wavelength and intensity of the light should be decided for this photodynamic therapy. If we are using for a deep-seated cancers, then we can use for NIR lights. Yes, it is a very deep penetrating power. Nowadays, it is mostly used now in the stream. It is interesting that in the earlier days, even the traditional gas lamps were used for this PDT therapy. Yes, normal lights were used, particularly to treat the skin cancers. Because it is just above, we can apply the photosensitizers like an ointment, then we can irradiate light on it. But later states, the lamp changed into light. Sorry, the lamp changed into LED. LED. So LED changed into lasers, which are proved that yes, the treatment is evolving, getting some advancement so that the treatment will be done with some efficacy. The light emitted from these lamps, like the gas lamps which were used earlier, which so to select the photoactivating wavelength to eliminate the infrared components also that can cause heating of the tissues, deheating of the tissues, and which will be used as a painkillers. Like if some photosensitizer is causing some pain, if you're irradiating light, then that may in turn create painkillers, means that pain you won't feel. So the potential of the PTT has increased now more effectively in the combination of laser light and optical fibers. So lasers have the more advantage of the narrow emission spectrum and high output power. So only it has been jumped from the lens to LED to lasers. And it has a required spectral range where the optical fibers allows the light to reach to the particular site inside the human body. So the lasers are more effectively used until recently. So now we can see the diode lasers. The lasers like argon dye lasers, YAZ lasers, and it's increasingly to diode lasers. Yeah, it's I was supposed to say semiconductor lasers. Sorry. Until recently, the power produced by the light emitting diode lasers are being too low. Yeah. From them to be used for the photosensitizers. The wavelength of the light range nowadays, we can tune it. Generated by the diode lasers is suitable for the use of products for the photosensitizers. Nowadays the lasers, they have a great advantage of low cost, high reliability, small size, and portability also is very good. So the light delivery system mainly depends on the location of the tumor and the site of the tumor. Yeah. To reach to the tumors of the body cavity, laser light is passed through endoscopically placed optical diffusers. So for the treatment of cancer or oral, like superficial means which are usually visible to us, so we can treat them easily. But for treating the cells, cancer cells which are deeply penetrating inside us, which is deeply seated in us, so for that it should be used endoscopically, which means we have to take the light inside, put the light inside and treat them. Now, so sorry. So the factors such type as photosensitizer, drug location, and the size of the tumor, irradiation wavelength, and intensity of the light will decide considerably the deciding length of the irradiation and how much frequency should be used over the light. So the protocol will not be same for each and every patient. It may differ depending on their body sensitivity or the allergy to the photosensitizers, and also most importantly the photosensitizers fluorescent property, like their wavelengths. So now we all know that the photosensitizers are given to the body or injected to the body. So sometimes there are like targeted and non-targeted. Non-targeted will not be directly into the cancer cell, and targeted will be directly to the cancer cells. So the nanoparticles, the use of nanoparticles here is they will help the photosensitizers, or they will carry the photosensitizers to the particular site so that they can get attached to that particular cancer cell, and when light is irradiated, they can process out their mechanism easily. So in this new generation of fluorophores, which is generally called as upconversion nanoparticles. Okay, we can use any type of nanoparticles like gold nanoparticles, silver nanoparticles, variety of nanoparticles, iron oxide nanoparticles, but these upconversion nanoparticles are recently used mostly used because they have the ability to convert the infrared radiations with lower energy to visible radiations with higher energy via a non-linear optical process. So recently, these upconversion nanoparticles has evolved and alternate fluorescent levels to traditional fluorophores. So great non-linear optical processes. So it is used in vitro and also in vivo applications. Upconversion nanoparticles exhibit bands high resistance to photobleaching, making upconversion nanoparticles an attractive alternative source for emergingly growing current limitations in traditional fluorescent probes. So what exactly the upconversion nanoparticles plays the role here is it have been investigated in order to allow the deeper penetrating or near infrared light, which is in the range of 980 nanometer to 800 nanometer to be used for the photodynamic therapy. Okay, actually what happens is like for example, NaYF4 or iridium, they have been attached to the photosensitizers, either by covalent conjunction or by absorption by coating with them by the process of synthesis. So for Foster resonance energy transfer to the photosensitizers allows the NIR, like infrared light energy, to be transduced deep tissue advantage of conversion nanoparticle photodynamic therapy. So the recently advances have induced dye synthesizers coupled with photosensitizer, and the combined with nanoparticles it will be introduced into the body, then light will be irradiated. So exactly, I have shown up GIF here, like a bus is traveling. Then the people are getting down from the bus and getting into a home. Just make it to understand. If you want to go to a place, we are taking the help of a vehicle so that we can reach to a particular place properly. Like starting from home to school or college or to a particular destination, either we take with a scooty or with a bus, any type of vehicular. Exactly. To reach to a particular site of cancer where the cancer cells are growing, particular the rooted site, the upconversion nanoparticle acts as the bus and the photosensitizer acts as a person. So it is the carrier which the upconversion nanoparticle is the carrier which carries the photosensitizer to a particular place. This was the whole thing which I wanted to explain now. So a variety of bioimaging modalities also can be done using the upconversion nanoparticles with the combination of the upconversion photodynamic therapy. It is done because the drug abilities of the upconversion nanoparticles improve the quantum yield, allows intentional injections and tumor targeting, and ensures lack of toxicity. Means it reduces the toxic levels to the very low rate and required doses before potential clinical applications. Mostly it is used nowadays. So if for nanoparticles are conjected with the photosensitizers, then it will show more fruitful results. Now we can see how the treatment process starts exactly. So the treatment process is such like the photosensitizers are prepared. It will be conjected with the nanoparticle. Then it will be injected into the body. Okay. Injected can be done with a syringe or with a scaffold type, any type. It will be transferred into the body and it will reach to a particular cancer site. After 24 to 72 hours, it will leave the normal cells. One more thing is that here, the biggest question can come while it's traveling, how it can identify a cancer cell and a normal cell. Usually, it will not identify, it will go on working towards. But after 24 to 72 hours, after a particular time, it will leave the normal cell and go away. But it will stay for more time in the cancer cells. Means beyond 72 hours also it will go and stay in that cell, so that while treating the light, it will be easier for the doctors to know, yes, it is the particular site where we want to irradiate the light. So now the light is irradiated. After irradiating the light, the reactive singlet oxygen will be produced, which will be responsible for eliciting the cell death, which means the cancer cells will be killed. After that, after the treatment, after 24 hours, or after 1 week, it is advised for the patients not to go out on the sun because sun is also producing the light. Yes, of course, it is the biggest source of light, and the light also can react with that photosensitizers. So usually after 1 week, the photosensitizers can be removed out from the body. This is the whole treatment process, and once the cancer cells are killed, the patient is free from cancer if it is totally killed. But most of the cases, yeah, it has seen that yes, the cancer cells are being killed in this photodynamic therapy case. Now, how we are getting the singlet oxygen so that it is killed away? So photodynamic therapy is a dynamic process. Yes, the name itself is containing dynamic. It is grounded on the photooxidation of living matter. The mechanism starts with the occurrence of the absorption. The photon energy must correspond to the energy of the difference between the ground state of a absorbing molecule and its excited photosensitizer which results in internal conversion of the molecule between the electronic state having electronic spin similar electronic spin, as a result of which the emission of the energy of the excitation of a molecule in the form of light and the energy of the emitted photons corresponds to the energy difference between getting emitting and the final state of the molecules, as they both of the same electronic spin. This is responsible for fluorescence. So now these are the ground state, these are the exciting states. So here the fluorescence will occur because they are of the same spin. Now we can proceed that the energy of the emitted photon corresponds to the energy difference between the emitting and the final states of the fluorescing molecules, as they both have the same electronic spin. Now this is the intersystem crossing of molecules into electronic states of different electronic spin, which is a quantum of phosphorescence, which means fluorescence is occurring with same electronic spin, the phosphorescence is occurring with different electronic spin. Hence, the photodynamic effects can be demonstrated by two mechanisms here. After it is changed into fluorescence and phosphorescence, two types of mechanism will occur here. It is type 1 mechanism and type 2 mechanism. But either it is type 1 or type 2 mechanism, we are going to get end or the final result will be like the singlet oxygen itself. But we have a different type of mechanism which may occur, which occurs usually. It is seen that. So type 1 mechanism is like the photosensitizer from its ambience transfer the energy in its triple excited state. When it will be in the triple excited state, it will transfer all of its energy to the macromolecules. An electron transferred from the photosensitizers to the cancerous cell, or the creation of free radicals and anionic radicals of the photosensitizer to the substrate. So, the electrons extract with the oxygen molecule. The electron will interact with the oxygen molecule, remaining in their elementary existing states, and in the initiated fall of reaction leads to the oxidative stress, creating reactive oxygen singlet, causing in the cancer cell destruction. So these were when biomolecule macromolecules, means large molecules are present. This type of mechanism will occur. When in absence of macromolecules, the reaction will go like the photosensitizer will be in the triple excited state. Now, it will directly transfer the energy to the oxygen molecule in the basic triplet state, as they have same spin. Here in type 2 mechanism, there will be same spin. In this way, the ground state oxygen molecule is elevated to the first excited state to call it as singlet oxygen. So singlet oxygen acts rapidly with the electrophile molecules and transfers energy to the oxygen, hereby reducing or hereby bringing the photosensitizers to its fundamental state. And this cycle repeats till a certain period of time. So this was the whole mechanism of the PDT, not PDT. So when light is irradiated, how it reacts. Clinically, it is used in dermatology, dental, mostly in different type of allergy reactions, bacterial reactions, microbial reactions, cancer cells, etc., etc., etc. It is like used in large number of cases. Nowadays, it is common treatment which most of the doctors advise people to take. So, photodynamic therapy usually is a common treatment modality in which it is systematically or locally administered photosensitizer is activated locally by irradiating light lesion site, and it is converted into tissue molecular oxygenation, hereby killing the cancer cells. Not only cancer cells, it can also cure any type of diseases. It is very easy to treat on the superficial treatments, but for the deeply seated tumors, the nanoparticles are mostly used, which act as a carrier or vehicular mechanism inside the body. So finally, there is no doubt that the dual function of the nature of the photosensitizers will play an important role. Not only photosensitizers light. So the final verdict is like that there is the whole PTT will play an important role in future clinical uses. Thank you.